Hello, I'm Brian Ulery, Chief Executive Officer of St. Clare's Health, and thank you for joining Let's Talk Health. I'm here with Dr. Greg Zimmerman, Medical Director of Robotic Surgery and Urologist at St. Clare's. Today, our topic is kidney stones are no gems. Welcome, Dr. Zimmerman.
Hi, Brian. How you doing?
Good. So let's begin with the reason it's important to talk about kidney stones. Can they be dangerous?
So kidney stones are very common and they're very painful. Anyone who's had a stone knows how painful they can be, but they can also be dangerous. If they're not treated in an appropriate amount of time, someone can get infected and even septic. So they are very treatable and they're even preventable.
Are kidney stones and gallstones the same?
No, they're totally different. They actually have no relation at all, and they're a totally different type of pain. Gallstones typically come and go with meals, and the pain is intermittent in nature, meaning it starts and stops. Kidney stones are unrelenting.
Well, what are the most common symptoms of kidney stones?
So the most common symptom is pain. Typically pain that starts in your back that will radiate around to your abdomen and pelvis. From there, you can get blood in the urine, which is disconcerting when patients see that. As the kidney stone travels down the ureter, it can get close to the bladder. So you can get symptoms that include urinary urgency and frequency. Those are common symptoms as well.
Are there different types of stones, or are they all similar?
There are many types of stones. The most common stones by far are calcium oxalate stones, accounting for about 80 to 85% of all stones. And those stones are easily seen on x-rays. But there are other types of stones too. There are uric acid stones, cysteine stones, struvite stones, which are caused by multiple and recurrent urinary tract infections. And there are also combination stones, which can have parts of each of the ones that I mentioned.
Well, who's at risk for getting kidney stones?
So typically, kidney stones can affect anybody. Men more than women. About 11% of men in their lifetime will have a stone. About 6% of women will have a kidney stone. If you've had a kidney stone, there's a 50% chance you will develop another kidney stone, at least one other kidney stone in your lifetime. But other things can cause kidney stones too, like dehydration, certain diet deficiencies, pretty much any process that causes high calcium in the urine, high oxalates, or acid can make you at risk for stones. And some of those things are gout, gastric surgery, and vitamin deficiencies. So Brian, I understand that you have some personal experiences with kidney stones.
Yeah, and the symptoms that you're describing are exactly what I've had. I've had blood in the urine, I've had a lot of pain in my back. They're a miserable experience. But I've been blessed to have doctors like you treating me throughout those experiences, and I know that there are very well qualified people at St. Clare's that could take care of me in the event that those symptoms arise again. So what are the methods that you use to diagnose kidney stones?
So the most common presentation is a patient that will come to the emergency room typically with pain. As I said before, they could have blood in the urine and urinary symptoms. So a careful medical history is really important because it can really clue you in that there is a stone. If you have the suspicion that a stone may be present, at that point, we typically will do laboratories looking for things like elevated white blood cell count, which could talk about inflammation or infection. We'll look at the urine to see if there's blood or signs of infection as well. And from there, if we still think a kidney stone is possible or probable, we'll order some imaging studies. Most commonly, we'll order a CAT scan of the abdomen and pelvis without contrast, which can tell you if the stone is there, it can tell you its position and its size, if there's a blockage of the kidney, and if something has to be done right away or not.
Well, from my personal experience, I do know that there are several different treatment options. Can you share with us what those treatment options are?
Well, when we first meet a patient with a stone, the first question we ask ourselves is, can we watch this? Can we give them a chance to pass it? Because the best case scenario is they actually do pass the stone on their own and they don't have to have any surgical intervention. There are some cases that we do not wait for that because we think there's a high risk of infection or even sepsis, or we don't think that the stone will pass. In general, stones that are about 5 millimeters in size have a 50% chance of passing. So if they're under 5 millimeters in size, we'll give them a chance to pass frequently if there's no sign of infection. But if they're over that size, we'll typically recommend intervention. So the interventions are as follows. First, sometimes we go up the ureter with a scope called ureteroscopy. There's no real major surgery that we do for acute stones. Everything is done with scopes, no incisions. We go up the ureter, we find the stone. Sometimes we break it up with a laser and basket the pieces out. So that's probably one of the most common things. Other things that we do is called extracorporeal shockwave lithotripsy, where we use sound waves to break the stones into smaller pieces, hopefully sand-like sizes, and then they can pass on their own. If someone has an extremely large stone that's filling the kidney, sometimes we have to do a bigger procedure, which includes radiology, putting a tube in the back, and then through that channel, we go right at the stone. We break it up and take it out, and that's called a percutaneous nephrolithotomy. But that's a rarer type of procedure that we do for stones.
Okay. Well, understanding that kidney stones can be quite painful and dangerous, are there steps we can take to prevent having kidney stones?
The general recommendations for stones are to increase water and lemon. Lemon can actually be a preventative of stones. It has something called citrate in it, which decreases the chances of you forming stones. We also try to avoid salt and a lot of animal fat in the diet. Both of those are associated with increased stones. Sometimes if someone has stones either at an early age or multiple recurrent stones, we'll order something called a 24-hour urine analysis. And on that analysis, it can tell us about abnormalities in the diet and metabolism that potentially we can correct with medications or supplements. So that can be very helpful.
Good. Well, we talk about St. Clare's Health being around the corner and ahead of the curve. What are the advantages of choosing St. Clare's Health for your care?
There's a few items that come to mind right away. First of all, at St. Clare's is typically shorter wait times in the emergency room. And so, as I mentioned, stones can be very, very painful. You're seen by a doctor usually quicker, which means they can diagnose you quicker and they can treat you quicker. Which means you'll be in less pain at shorter intervals. The other thing that can happen is if they can make the diagnosis quicker, they can get the appropriate doctor on board, and if you do need treatment, we can start that earlier. And the result of that is hopefully less infections, less chances for things like sepsis. So that's the first thing that comes to mind. The second thing that comes to mind is at St. Clare's, we're always looking to find the latest and greatest in terms of technology. So we have the latest scopes, we have the latest lasers, and we're always looking for what's going to help patients get better quicker.
Well, thank you so much, Dr. Zimmerman, for sharing this important information with us. And we thank you for watching Let's Talk Health and invite you to follow us on Facebook, Instagram, or YouTube. For more information, visit stclares.com. Thank you.